Heart disease is still the #1 killer in the United States, taking more lives every year than all forms of cancer combined. People in the United Kingdom, Canada, and Australia are also seeing heart-related illnesses rise sharply. And what's worse, many of these heart problems are entirely preventable with food. The American diet, packed with processed meats, refined sugars, cheap seed oils, and sodium-loaded fast food, has pushed our cardiovascular systems to the brink. This is not just about eating less, it's about eating right. And it's not a joke. Many people are one meal away from a heart attack and don't even know it. One of the most powerful foods you can eat for your heart is wild-caught salmon. Unlike farm-raised salmon, which can be loaded with inflammatory omega-6 fatty acids and contaminants, wild-caught salmon is rich in omega-3 fatty acids, particularly EPA and DHA. These fats are essential in reducing triglyceride levels, stabilizing heart rhythms, and reducing inflammation in arterial walls. Omega-3s improve endothelial function, which is the inner lining of your blood vessels, keeping them relaxed and elastic. A study published in the Journal of the American College of Cardiology found that consuming omega-3s consistently reduced the risk of fatal heart arrhythmias. If you've ever heard of someone who suddenly dropped dead with no prior symptoms, there's a real possibility it was due to a deadly arrhythmia. People in Alaska, who traditionally eat a lot of wild salmon, show some of the lowest rates of heart disease in the United States. That's not a coincidence. The fat in salmon actually feeds your heart cells, but you need at least 2 to 3 servings per week, and it has to be wild, not the pink-dyed garbage they sell cheaply in big chain stores. Another food with outstanding cardiovascular benefits is avocado. Avocados are loaded with monounsaturated fat, the type of fat that lowers LDL cholesterol and raises HDL cholesterol. This is critical because LDL, bad cholesterol, tends to oxidize and stick to artery walls, while HDL, good cholesterol, acts like a vacuum, pulling excess cholesterol out of the blood and back to the liver for excretion. In the United States, avocado has become a trendy superfood, but its real power lies in its nutrient profile, high in potassium, magnesium, folate, and vitamin E. Potassium helps balance sodium levels and relax blood vessel walls, which lowers blood pressure naturally. One avocado contains more potassium than a banana and far less sugar. Many heart patients are loaded on prescription potassium supplements, especially in the United States, because their diets are so deficient. Avocado fills that gap naturally. A study in the Archives of Medical Research found that people who ate 1 avocado per day had significantly improved lipid profiles. If you've ever had your cholesterol levels checked and felt terrified by the numbers, you might want to ask yourself, how often do I eat real, whole, unprocessed plant fats? Leafy greens like spinach, kale, and Swiss chard are another category of heart-saving foods that most people in the United States barely touch. Packed with nitrates, magnesium, and vitamin K1, these greens help your blood vessels dilate and reduce arterial stiffness. In the Framingham Heart Study, a cornerstone of cardiovascular research in the United States, individuals who ate the most leafy greens had dramatically lower rates of calcified arteries. Vitamin K1 prevents calcium from depositing into the blood vessels, directing it instead to your bones. Magnesium in leafy greens improves insulin sensitivity, which is critical because type 2 diabetes doubles the risk of heart disease. But most Americans aren't getting even close to the recommended intake of magnesium, and leafy greens are one of the cleanest sources available. They also detoxify the body and support liver function, which plays a direct role in cholesterol production and regulation. If your LDL cholesterol is high, your liver is part of the problem, and your diet can be the solution. Berries, especially blueberries, strawberries, and raspberries, are heart heroes in disguise. These fruits are loaded with anthocyanins, which are powerful antioxidants that reduce oxidative stress and protect your arteries. Anthocyanins are what give berries their deep color, and research from the Harvard School of Public Health showed that women who consumed more than 3 servings of berries per week had a 32% lower risk of heart attack. That's massive. In the United States, many people consume fruit-flavored drinks or yogurts and think they're getting berries, but they're just getting sugar, dyes, and artificial flavors. You need real, whole berries. Frozen is fine, but they must be unsweetened. The fiber in berries also helps regulate blood sugar, which is important because blood sugar spikes damage the blood vessels over time, leading to hardened arteries and increased risk of stroke. Berries also improve nitric oxide production, helping blood flow and lowering blood pressure. In Canada, where access to fresh produce can be limited in winter, frozen berries are a smart alternative and should be stocked year-round. Nuts, especially. Walnuts, almonds, and pistachios are dense in heart, healthy fats, fiber, and plant sterols. Walnuts, in particular, are one of the few nuts that provide a significant source of omega-3s. A study published in the journal Circulation found that daily walnut consumption improved endothelial function and reduced inflammation markers like CRP, C-reactive protein. The issue is that many people in the United States eat their nuts coated in sugar, chocolate, or salt, completely destroying their benefit. Raw or dry roasted, unsalted nuts are what your heart craves. Almonds are especially rich in vitamin E, a fat-soluble antioxidant that protects against oxidative damage in the arteries. Pistachios help lower LDL cholesterol and also provide L-arginine, which the body uses to produce nitric oxide for improved circulation. People who include a small handful of nuts daily, especially in place of a processed snack like chips or candy, see major cardiovascular benefits over time. But portion control matters. 1 ounce is plenty. Too many nuts can tip the calorie balance, leading to weight gain, which increases cardiovascular risk again. Olive oil, especially extra virgin. Olive oil, EVOO, is a staple in the Mediterranean diet, one of the most heart-protective diets ever studied. Unlike heavily processed vegetable oils that dominate the American food system, like soybean, corn, and canola, extra virgin olive oil contains phenolic compounds that directly reduce inflammation, improve cholesterol ratios, and support vascular integrity. In the pre-dimed study conducted in Spain, people who consumed high levels of EVOO had significantly fewer heart attacks and strokes, even when their diets included moderate amounts of fat. The quality of the fat made the difference. Americans have long been told to fear fat, but that message was dangerously misleading. It's about the type of fat. In Australia, EVO is gaining more attention in cardiac rehabilitation programs, and some hospitals now even include it in patient meals. The problem is that the American market is flooded with fake or adulterated olive oils. You need a reputable source, preferably in dark glass bottles with harvest dates, and use it raw or lightly heated, not fried. Real EVOO smells fresh, almost grassy, and leaves a peppery sensation in the throat. People often overlook dark chocolate, but high cacao dark chocolate, above 70%, can be a surprising heart health ally. It's rich in flavonoids, especially epicatechin, which improves blood flow and reduces blood pressure. The Kuna Indians of Panama, who drink unprocessed cacao daily, have some of the lowest blood pressure levels ever recorded, despite consuming more sodium than most Americans. But it must be real dark chocolate. Most chocolate products in the United States are heavily processed and loaded with sugar, milk, and palm oil. 1 small square of true dark chocolate per day, ideally organic and fair trade, can increase nitric oxide production and help arteries relax. It also reduces cortisol levels, which is crucial because chronic stress is another hidden driver of heart disease. Elevated cortisol from stress raises blood pressure, blood sugar, and cholesterol. In the United Kingdom, where stress-related cardiovascular events have surged post-pandemic, dark chocolate is being studied not just as a dietary tool, but as a lifestyle intervention. Another powerful food is beans, especially black beans, kidney beans, and lentils. Beans are packed with soluble fiber, which binds to cholesterol in the gut and helps flush it out of the body. That's a natural statin without the side effects. In fact, the American Heart Association has endorsed legumes as a top-tier food for heart health. Studies show that eating just 1 cup of beans daily can lower LDL cholesterol by up to 12%. They also help regulate blood sugar and improve gut health, both of which are closely tied to cardiovascular risk. But in the United States, beans are often drowned in salty sauces or loaded with lard, which defeats the purpose. Plain, rinsed, and seasoned with herbs, beans can replace meat in many dishes without sacrificing satisfaction. In Australia, where plant-based eating is rising, beans are being used more creatively in everything from burgers to stews to snacks. One of the most underutilized yet incredibly heart-protective foods is garlic. Not just a seasoning or flavor enhancer, garlic has clinically proven benefits on blood pressure, cholesterol, and overall vascular health. Allicin, the compound responsible for garlic's potent smell and taste, is also its most powerful medicinal component. Research has shown that garlic supplementation can lower systolic and diastolic blood pressure to the same degree as low-dose prescription drugs without the side effects. In the United States, millions of people are put on blood pressure medications without first being told that raw or aged garlic could be just as effective. In Canada and the United Kingdom, garlic is sometimes included in alternative therapy plans for cardiac patients, especially in early stages of hypertension. It also improves blood flow and reduces platelet aggregation, which lowers the risk of clot formation, a major cause of heart attacks and strokes. But for real benefits, garlic needs to be eaten raw or minimally cooked. Chopping or crushing it and letting it sit for 10 minutes before using it activates the allicin. Garlic capsules can also help, but not all supplements are created equal. Aged garlic extract, used in many clinical studies, is more stable and well tolerated, especially for people with digestive sensitivity. People have reversed early-stage hypertension with garlic and diet alone, and yet most have never even tried it. Another food that deserves a spot in a heart-protective diet is green tea, especially matcha or high-quality sencha. Green tea is packed with catechins, especially EGCG, epigallocatechin gallate, a compound that has been shown to improve lipid profiles, reduce blood pressure, and protect LDL cholesterol from oxidation. It also enhances nitric oxide activity, helping blood vessels relax and improve blood flow. Unlike black tea or coffee, green tea does not overstimulate the nervous system, which is critical for heart health. Chronic overstimulation from caffeine can increase heart rate and cortisol, both of which stress the cardiovascular system. In Japan, where green tea is consumed daily, the rate of heart disease is dramatically lower than in the United States. In the United Kingdom and Australia, green tea is now recommended in some cardiac rehabilitation nutrition protocols. But Americans often add sugar, milk, or flavorings, which completely nullify its benefits. Real green tea should taste grassy or even slightly bitter. That's how you know the catechins are present. Matcha is even more potent because it's made from whole ground leaves, offering more antioxidants per serving. Studies show that people who drink 3 to 5 cups of green tea daily have a significantly lower risk of death from cardiovascular causes. Whole oats, especially steel-cut oats or rolled oats, are one of the most studied foods when it comes to lowering cholesterol and protecting the heart. The key is beta-glucan, a soluble fiber that binds to cholesterol in the digestive tract and pulls it out of the body before it can enter the bloodstream. This is not speculation. Over 50 studies confirm that regular oat consumption lowers total cholesterol and LDL cholesterol without affecting HDL. But it must be whole oats, not instant packets full of sugar and artificial flavors, which dominate the American grocery aisles. The typical boxed apple cinnamon oat cereals or microwave cups are nothing but refined carbs with tiny traces of oats. Real steel-cut oats take longer to cook, but provide a sustained energy release and support gut health as well, which further lowers inflammation. In Australia and Canada, dietary guidelines specifically recommend oats as part of a cholesterol-lowering diet. People who switched their breakfast from processed cereal to whole oats saw changes in their lipid panels in just weeks. Adding a tablespoon of ground flaxseed, some cinnamon, and berries turns it into a powerful heart-healing breakfast. The combination of fiber, antioxidants, and plant lignans makes it one of the cheapest but most effective meals you can eat daily. Flax seeds and chia seeds are often overlooked but should be considered daily medicine for the heart. Flax seeds are the richest plant source of alpha-linolenic acid, ALA, a type of omega-3 that the body can convert to EPA and DHA, though less efficiently than from fish. Still, they play a significant anti-inflammatory role and help lower blood pressure and arterial stiffness. A study published in Hypertension found that daily flaxseed consumption led to significant reductions in blood pressure among people with high blood pressure. Ground flax seeds are better than whole because the outer shell is tough and hard to digest. Flax also provides lignans, plant compounds with powerful antioxidant and estrogen-modulating effects. Lignans protect against atherosclerosis by reducing oxidative stress on blood vessel walls. Chia seeds, on the other hand, swell into a gel-like texture when soaked, which slows down digestion and prevents blood sugar spikes, crucial because glucose surges damage arteries and accelerate plaque buildup. Chia is also rich in soluble fiber, magnesium, and plant protein. In the United States, where fiber intake is alarmingly low, less than 15 grams per day on average, adding these seeds into your meals is an easy, non-pharmaceutical intervention with measurable heart benefits. They can be stirred into oats, smoothies, or yogurt, or used to thicken soups. Turmeric, especially when paired with black pepper to enhance absorption, is one of the most powerful anti-inflammatory substances you can consume. The active compound, curcumin, has been studied for its effects on arterial stiffness, endothelial function, and systemic inflammation, three key drivers of cardiovascular disease. In the United States, chronic inflammation is rampant due to processed foods, sedentary lifestyles, and underlying metabolic disorders. Curcumin inhibits NF-κB, a molecule that turns on genes related to inflammation. Studies from the American Journal of Cardiology have shown that curcumin supplementation improves vascular function even in patients with diabetes and coronary artery disease. In Canada, turmeric is now commonly found in heart-healthy food products and even functional beverages. The problem is, raw turmeric or powdered turmeric alone isn't well absorbed. Pairing it with black pepper, which contains piperine, increases absorption by up to 2,000%. Whether taken as a supplement or added into curries, smoothies, or golden milk, turmeric helps calm the inner lining of the arteries and reduce the risk of clot formation. Pomegranates are another fruit that deserves much more attention for heart health. The juice and seeds are loaded with polyphenols, particularly punicalagins, which have been shown to reduce arterial plaque buildup and improve cholesterol profiles. In studies, pomegranate juice reduced the thickness of carotid artery walls in just 12 months. In the United States, where plaque buildup often goes undetected until a stroke or heart attack occurs, this is critical. Pomegranates also lower blood pressure and increase nitric oxide production. But like with other fruits, the American food industry has ruined pomegranates by turning them into high-fructose drinks and sugary snacks. You need either the whole seeds or 100% pomegranate juice with no additives. In the United Kingdom and Australia, pomegranate extract is being studied for its anti-atherosclerotic properties. Many people report feeling more energy, improved circulation, and less chest tightness after regularly including pomegranate in their diet. Anecdotal or not, when combined with the data, it's clear this fruit has a profound vascular impact. For people in the United States, Canada, the United Kingdom, and Australia, who face rising heart disease statistics year after year, the message is urgent. Food can destroy your heart, or it can save it. Each of these foods isn't just healthy, They are anti-disease, anti-plaque, blood-smoothing, artery-clearing weapons against the silent killer that heart disease has become. The difference between someone who dies at 58 from a massive heart attack and someone who lives a full life into their 90s often comes down to small, consistent dietary choices. That first twinge of chest pain, the high blood pressure diagnosis, or the terrifying moment you hear, "You need a stent," none of that has to be your story. You can take back control with a fork, not just a prescription. The food you eat is either pushing you toward the ER or pulling you away from it. And every single bite matters.